Denosumab, also known as Xgeva Vial, is a medication used to treat bone problems in people with multiple myeloma or cancer that has spread to the bones. It is also used to treat high blood calcium levels that may occur with cancer. Additionally, it may be used to treat a certain disease called giant cell tumor of the bone in adults and teenagers who have reached their final adult height and cannot undergo surgery. The daily dosage and optimal timing for taking this medication can vary depending on individual circumstances, so it's important to consult with a healthcare professional for personalized guidance. This medication is administered by injection under the skin in the upper arm, upper thigh, or abdomen, usually every 4 weeks as directed by your doctor. If you are using this medication to treat giant cell tumor of the bone or high blood calcium levels, your doctor may also direct you to receive additional doses once a week during weeks 2 and 3 of the first month of treatment. It's important to use this medication regularly to get the most benefit from it. Remember to receive it every 4 weeks, and it may help to mark your calendar with a reminder. You may also be instructed to take calcium and vitamin D supplements. Make sure to follow your doctor's instructions carefully. If you experience tiredness, weakness, headache, back pain, diarrhea, or nausea, it's important to let your doctor know. This medication has been prescribed to you because the benefits outweigh the risks. Some people may experience jaw pain, unusual thigh/hip/groin pain, bone/joint/muscle pain, or shortness of breath. It may also cause low levels of calcium in the blood, so be sure to take calcium and vitamin D as directed by your doctor. Keep an eye out for symptoms of low calcium, such as severe muscle spasms, mental/mood changes, numbness/tingling, seizures, or fast/irregular heartbeat. Denosumab can affect your immune system, making you more susceptible to serious infections. Watch out for signs of infection, like fever, red/swollen/tender skin, severe abdominal pain, ear pain/discharge, or frequent/painful/burning urination. Skin problems such as dryness, peeling, itching, bumps/patches, or blisters can also occur, so seek medical help if you develop a rash or if these symptoms worsen. After stopping treatment with denosumab, you may experience high levels of calcium in the blood, especially if you have not reached your final adult height. If you notice symptoms such as nausea, vomiting, headache, or unusual tiredness, contact your doctor. It's also important to discuss other treatment options with your doctor, as stopping denosumab may increase your risk of bone fractures in your spine, especially if you have osteoporosis or have had broken bones. Although rare, a serious allergic reaction may occur. Seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. Be aware that this is not a complete list of possible side effects, so it's essential to contact your doctor or pharmacist if you notice any other effects not mentioned. Before using Xgeva Vial, make sure to inform your doctor or pharmacist if you have any allergies or if you have a history of low calcium levels in your blood or kidney disease. Some people using Xgeva Vial may experience serious jawbone problems, so your doctor should check your mouth before starting this medication. It's important to inform your dentist that you are using this medication before any dental work. To help prevent jawbone problems, make sure to have regular dental exams and maintain good oral hygiene. Before any surgery, especially dental procedures, inform your doctor and dentist about this medication and any other products you are using. Xgeva Vial is not recommended for use in children, except for the treatment of giant cell tumor of the bone. It may affect a child's growth and tooth development. This medication must not be used during pregnancy, as it may harm an unborn baby. It's important to use reliable forms of birth control during treatment and for at least 5 months after treatment. If you become pregnant or think you may be pregnant, inform your doctor immediately. It's unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. When taking Xgeva Vial, it's important to be aware of potential drug interactions. These interactions can impact how your medications work and may even increase your risk for serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. It's important to not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Xgeva Vial. Always consult with your healthcare provider before making any changes to your medication routine. If someone has taken too much Xgeva Vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the local poison control center at 1-800-222-1222, and in Canada, residents can reach out to a provincial poison control center. While taking Xgeva Vial, it's important to have regular lab and medical tests to monitor your calcium and phosphorus levels, as well as kidney function. Make sure to attend all scheduled medical and lab appointments and consult your doctor for more information. It's also crucial not to take this medication with any other product that contains Denosumab. This can help ensure the effectiveness of the treatment. If you forget to take a dose of Xgeva Vial, make sure to contact your doctor or pharmacist to determine the best time to take your next dose. It's important to take this medication as prescribed to ensure its effectiveness. You will not be storing Xgeva Vial at home as it is typically administered in a clinic or doctor's office. It is important to not flush this medication down the toilet or pour it into a drain unless instructed to do so. When this product is expired or no longer needed, it should be properly discarded. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.